Well, I pursued psychiatry because I was completely shocked as a young doctor at the raw deal that people with mental illness were getting from the health system. And I was lucky enough to be able to work with young people with the first episode of psychosis back in the 1980s as we were setting up a research unit. And you could see that the young people in particular had so much to gain from early intervention and effective treatment, which really just didn't exist at that time. Through our research identifying early symptoms of psychosis, we showed that it was actually possible to delay the onset of this illness. This was actually the first time this had ever been done, and it took at least 10 years of research working on the prediction and defining the at-risk mental state. And we've also been conducting clinical trials to work out how we can help people to avoid the consequences of these illnesses. Even if we can't actually prevent the first psychotic break, we can definitely reduce the collateral damage that occurs during this prodromal or pre-psychotic period, be it homelessness, substance abuse, family stress, vocational failure. All of these things can be prevented. The NARSAD grant that I received in 1988 as a Distinguished Investigator Award was a key injection of a much needed flexible funding to help us set up the infrastructure for our clinical trials. As an Australian, I'm incredibly honoured to receive this award because I remember when I was a young researcher, every award was from the Northern Hemisphere, so I think it shows we've come a long way in this country. What we need now is reform of the whole mental health system, a redesign, and that means a fair deal for people with mental illness. Even 10 years ago, certainly 20 years ago, we couldn't have imagined that it would be possible to identify young people in the early stages of a potentially serious mental illness and effectively reduce their risks of developing a psychotic disorder. We're certainly on the right track, and we can definitely help them have much better lives.